Hello, everyone. My name is William, and I'm going to be going over the experience that I had during my precepting project. My preceptorship would have been at Overland Park Regional Medical Center, and my audience was both the patients and staff of this year's graduating nurse residency program. According to the CDC, the majority of Americans do not get enough physical activity or adhere to what is considered a nutritious diet. This places them at risk of many health complications such as heart disease and cancer. In many cases, nutrition and exercise are a choice, but some of the members of my community have spoken out about barriers that prevent gainful physical activity and good nutrition. These barriers take their choice away, and many have stated that if these barriers to their health were absent, they would be more physically active and eat healthier. Patients at a hospital are generally not healthy and require intervention for optimal outcomes. Many patients, when they go home, require physical therapy and proper nutrition to promote healing, stave off illness, and build strength. If the patient can discharge home and have these needs met, their outcomes will improve and their chances of readmitting to the hospital will be reduced. Even for relatively healthy patients, physical activity and nutrition can reduce the risk of acquiring complications commonly acquired from hospitalizations, such as pneumonia and deep vein thrombosis. Aside from the usual scholarly articles that we are all so fond of, I used a few investigative strategies. Firstly, I interviewed my patients while working in a medical surgical unit in a hospital. I interviewed a social worker that was responsible for patient resources upon discharge. I then interviewed a nurse who has a background in home health. Through this, I gained many perspectives on the life of patients after they leave the hospital. From what I gathered, many members of my community that discharged from my hospital have several factors that limit their ability to adhere to a lifestyle best suited for health and well-being. For those that are physically limited to walking for exercise, sometimes their environment limits them greatly. They claim there are no safe places for them to walk. A 2016 study also found that many American residents find it hard to walk due to available walking spaces being taken up by traffic. Many other patients are confined to their homes and cannot get to a grocery store without help. They are often limited to eating food that can store for a long periods of time, and this means they often miss out on fresh foods. Many patients also can't afford to have food brought to them. Some patients have home health, which can be very beneficial to their health, but they often claim that these people don't visit often enough and they need more help than they get. Though there are many resources today that can help these individuals, they are mostly new and the patients are not knowledgeable about these resources. To solve these problems, I have compiled 4 primary interventions on my own. I was just one nurse that probably just talked too much, but with the assistance of my fellow healthcare team members, we can change a lot of people's lives. For this reason, my first intervention is to educate the healthcare team. We can teach new nurses about our findings and the following interventions that they can take part in improving patient outcomes. We can educate our patients on the need for physical activity and good nutrition. They are leaving the hospital and we don't want them coming back. Many patients need to get moving and eat well to heal and get their strength back, especially post-op patients and trauma patients. Patients who are limited by their surroundings can often still exercise, such as range of motion, laying down, or chair sits, which is just sitting in a chair and standing back up. These movements are a great first start for those with injuries or weakness. And when it comes to nutrition, nutrition is often very hard for some patients to improve, especially if they are confined to their homes or can't cook anymore. Recently, our civilization has transitioned to a bunch of homebodies. This means there are many services such as Shipt, DoorDash, or Uber Eats that now will often be able to transport nutritious groceries to your local grocery, or I'm sorry, from your local grocery store to your home. Many of these services deliver groceries for a very small charge. There are also other services for those that can't cook for themselves, like Meals on Wheels. The purpose of these interventions is to improve the overall awareness of healthcare workers so that we can meet the needs of our patients. This awareness can improve patient outcomes and prevent readmissions. In an effort to share what I had learned with my colleagues, I shared a short presentation to my graduating nurse residency course, and I shared a list of the information with the unit managers to keep on their unit so other staff could become aware of this opportunity. Still today, and hopefully for years to come, we can continue to offer awareness and education to our colleagues and patients. For reevaluation, the best opportunity to reevaluate the effectiveness of the interventions would be to integrate questions regarding them in the patient follow-up calls that happen in the first week after discharge. I actually get to help with them a lot, so this would be easy for me, but also adding this reevaluation to follow-ups done by unit secretaries would be beneficial too. In conclusion, that is my interventions for community access to physical activity and nutrition in my county. To reiterate, it's the healthcare workers that can spread the word about resources and workarounds for patients that have barriers hindering physical activity or good nutrition. Doing simple home exercises or ordering food from services like Shipt may be required for them to have better outcomes. And teaching them these tricks and opportunities can help them long after they return to their lives outside of the hospital. That's all I've got for you guys. Thank you very much.